Hello friends, let us read last minute revision points given by Dr. Bhatia about pediatrics and radiology. Okay, the credit will go to Dr. Bhatia. I am just reading their points. A child of phenylketonuria mother may develop microcephaly, mental retardation and congenital heart disease. Mousy odor urine is seen in maple syrup urine. Hereditary fructose intolerance occurs due to deficiency of enzyme aldolase B. Classical galactosemia occurs due to the deficiency of enzyme galactose 1-phosphate transferase. So hereditary fructose intolerance is due to deficiency of enzyme aldolase B. And classical galactosemia is due to deficiency of enzyme galactose 1-phosphate transferase. Cataract in galactosemia occurs due to accumulation of galactitol. So cataract in galactosemia occurs due to accumulation of galactitol. In Gaucher's disease, there is accumulation inside the cell of cerebrocytes. So cerebrocyte accumulation is seen in Gaucher's disease. Deficiency of enzyme in Tay-Sachs disease is hexosaminidase. So in Tay-Sachs, what is the enzyme deficiency? Hexosaminidase. All lysosomal storage disorders are autosomal recessive except Fabry's disease. Fabry's is X-linked recessive, I guess. Just cross check once. All lysosomal storage disorders are autosomal recessive except Fabry's disease. Enzyme deficient in Fabry's disease is galactosidase, alpha galactosidase. So Fabry's disease, what is the enzyme deficient? It is alpha galactosidase. In Gaucher's disease, there is accumulation of cerebrocytes. Tay-Sachs disease, hexosaminidase deficiency. Okay. In hereditary fructose intolerance, deficiency of aldolase B. Okay. So enzyme deficiency in Fabry's disease is alpha galactosidase. Flask-shaped deformity of femur is seen in Gaucher's disease. So flask-shaped deformity of femur is seen in Fabry's Gaucher's disease. Okay, just remember, flask-shaped deformity of femur is seen in Gaucher's disease. Okay. Zebra bodies are features of Niemann-Pick disease. Niemann-Pick disease is sphingomyelin deficiency. So I told you Niemann-Pick disease, three types are there: A, B and C. AB is due to sphingomyelin deficiency and C is due to some defect in cholesterol esterification. Okay. Vaccine associated paralytic poliomyelitis is associated with poliovirus type 2. So vaccine associated paralytic poliomyelitis is associated with poliovirus type 2. Seizures are maximum due to which component of TPT? Pertussis component. Dose of hepatitis B vaccine in a normal child is 10 micrograms. Oral typhoid 21A vaccine is given on alternative days, that is 1, 3 and 5 days. Just remember, hepatitis B vaccine for normal child you give 10 micrograms, and oral it is included in universal immunization, hepatitis B recently. Okay, oral typhoid 21A is given in the alternate days, that is 1, 3 and 5 days. Okay. DPT is contraindicated in evolving neurological illness. Okay, because pertussis causes seizures. Typhoid VI polysaccharide vaccine is usually administered in children above the age of 2 years. So VI polysaccharide you give above the age of 2 years. Varicella vaccine is live attenuated. Most common age group affected by infantile colic is 0 to 3 months. Order of development of secondary sexual characters in male. First is testicular development, next is pubic hair, next is axillary hair and next is bird. Maximum growth spurt is seen in girls at the time of menarche. Pincer grasp develops at the age of 9 months. Child changes rattle from one hand to other hand at 6 months. Handedness develops at 36 months, that is 3 years. So 3 years you should develop, handedness develops at 3 years. Okay, that is 36 months. And from one hand to another hand it changes the rattle at 6 months. Okay, pencil grasp at 9 months. The age by which most of the normal babies know their gender is 3 years. A child is able to build blocks of 5 cubes at the age of 18 months. A normally developing 10-month-old child will not be able to build a tower of 3 to 4 cubes. Kelly B lines seen in mitral stenosis and lymphangitis carcinomatosa. Kelly B lines, we know they are characteristically seen in mitral stenosis in X-rays, and they are also seen in lymphangitis carcinomatosa. Water lily sign is seen in chest X-ray of echinococcus. So water lily sign is seen in chest X-ray of echinococcus. Popcorn calcification is characteristically seen in pulmonary hamartoma. So popcorn calcification is seen in pulmonary hamartoma. Spring water cyst is another name of pleuropericardial cyst. So spring water cyst is another name of pleuropericardial cyst. Inferior rib notching is seen in coarctation of aorta. So inferior rib notching is seen in coarctation of aorta. You see inferior rib notching, not superior rib notching. So just remember coarctation of aorta, you see inferior rib notching. In tetralogy of Fallot, there is coar and subboot shape of heart. Okay, tetralogy of Fallot, you see coar and subboot shape, that is boot shaped heart. Snowman sign is seen in TAPVC. Egg-on side appearance is seen in uncorrected TGA. Okay, just remember TAPVC is like ice. PVC. Okay, C is for ice and snowman is there. So snowman is there in the ice is TAPVC. Egg-on side appearance is seen in TGA. Okay, corkscrew esophagus is seen in diffuse esophageal spasm, and we know rat tail is seen in carcinoma esophagus. Corkscrew is seen in diffuse esophageal spasm. Investigation of choice in diffuse esophageal spasm is barium examination showing tertiary contractions. So barium examination showing tertiary contractions. Okay, gold standard investigation for GERD is 24-hour intragastric pH monitoring. Barium swallow is investigation of choice for Jenker diverticulum. Okay, early gastric cancer generally indicates gastric adenocarcinoma confined to the mucosa and submucosa. Gold standard investigation for recurrent GIST, that is gastrointestinal stroma tumor, is PET. Okay, positron emission tomography. So gold standard investigation for GIST is PET. The most characteristic radiological feature of small intestine obstruction is prominent valvular convenience. So prominent valvular convenience, if they are present, it denotes small intestinal obstruction. Investigation of choice for small intestinal tumor is CT without contrast. In Crohn's, enteroenteric fistulas are commonly seen. Okay, in which disease enteroenteric fistulas are seen? In Crohn's. Pneumoperitoneum, because there will be transmural inflammation, so it can form fistulas from one part of the intestine to other part. Pneumoperitoneum can be best diagnosed by left lateral decubitus view. So pneumoperitoneum can be diagnosed by left lateral decubitus view. Double bubble sign is seen in duodenal atresia. Mucosal granularity is the earliest sign of ulcerative colitis on double contrast barium enema. So double bubble duodenal atresia, mucosal granularity is the earliest sign of ulcerative colitis on double contrast barium enema. An important screening test for functional anorectal dysfunction is balloon expulsion test. So anorectal dysfunction can be known by balloon expulsion test. Pudendal nerve terminal motor latency, that is PNTML, that is pudendal nerve terminal motor latency, can best evaluate the extent of injury to the sphincter muscles in patients with incontinence. Okay, so if there is urinary bladder incontinence, then you do this terminal motor latency, pudendal nerve terminal motor latency, and it evaluates the function of sphincter muscles, okay, in patients with incontinence. The most common facial abnormality in Gardner's syndrome is multiple osteomas in the face. So what you see in the face in Gardner's syndrome? Multiple osteomas. The best investigation to diagnose Hirschsprung's disease is rectal biopsy. For Hirschsprung's disease, you use rectal biopsy. The investigation of choice for detecting minimal ascites is ultrasound. Investigation of choice for detecting minimal intraperitoneal fluid is CT. Rapid sequence excretory urography is used in suspected renovascular hypertension. So, in renovascular hypertension, if it is suspected, then you do rapid sequence excretory urography. Non-visualization of kidney in excretory urogram is seen in renal vein thrombosis. So, in renal vein thrombosis, there can be no kidney seen in excretory urogram. So, hydronephrosis may be absent on ultrasound when obstruction is associated with staghorn calculi. So, hydronephrosis cannot be detected if the obstruction is due to, may not be detected if the obstruction is due to staghorn calculus. The most sensitive imaging modality for diagnosing ureteric stones in a patient with acute renal colic is non-contrast CT scan of the abdomen. So, if there are ureteric stones, you can do CT scan of abdomen, that is the most sensitive. For renal stone, diagnosis by MRI. For calcification, CT scan. For investigation of choice for bladder calculus is again CT scan. Okay. Filarial dance sign is seen in ultrasound. Medullary cystic disease can be best diagnosed by renal biopsy. Most important investigation for posterior urethral valve is micturating cystourethrogram or urethrophy. See, okay, it's important. They're giving different investigations for stones. If the stone is present in kidney, you do MRI, and if it is present in the ureter, you do non-contrast CT. Okay, and if the stone calcification is suspected, you do CT scan. So it can be best detected in CT scan. IOC investigation of choice for bladder calculus is again CT scan. Only for this one you do renal stone, you do MRI. Sorry, renal stone diagnosis is not done by MRI. This is a negative bit. So these negative bits are very confusing. So for renal stone, you should not do MRI. That's what they have given. Okay. I think ultrasound is sufficient. Only for bladder and ureter, you do CT scan. Calcification is detected by CT scan. Filarial dance sign is seen in ultrasound. Medullary cystic disease, you do renal biopsy. Most important investigation for posterior urethral valve is MCU. Okay, this ends this pediatrics and radiology. I'll come with the next document soon. Good luck.